Okay, as promised, I have these 7 new revised tips on how to pass this next generation NCLEX exam. I'm Dr. Shelly of HETV, Shelly's Nursing Review, and I told you, unless you have students that have actually experienced this test, it's hard to know how to guide more students to pass the test. So of course, we've got our big whopping 100% passage rate for the new test. Don't take that seriously because the test just started. Of course, it's 100%. But for real though, I feel really good about it. So I want to share with you these 7 tips on how to pass this next generation NCLEX exam so that you're not so freaked out about it. Because I really believe between you and me and the walls, it's easier. Yeah, I think it's just for now, it's easier because I don't know whether they don't want to fail everybody or what that's about, but I'm giving you my honest to God assessment that this test is doable. And I would never say a test is easy. I just feel like some kind of weird freaking way, this test is a little bit easier than your previous test that you took before this test changed. So stay with me, follow me, come with me, subscribe. We've got things to talk about. Here we go. 7 new revised tips on passing the new NGN NCLEX exam. Number 1, just fucking do it. Yeah, no, I'm sorry. My name is not Nike, but I stand by the Nike logo. Just do it. What do I mean by that? Because that sounds like cliche, right? Here's what I mean. I know full well, because I know some of you personally, I know full well that some of you are in freak out mode. Some of you have failed the test 7 times, 3 times, 4 times, unnumbered times. We won't even go there. And you are thinking, well, forget it now. The test changed. Fuck it. I ain't doing it. I can't do it. No, wrong answer. Because I believe the way this test changed to reflect case studies is that people who failed the old test before should jump on board and take this bad boy right now. Because I promise you, it will never be this easy again. In fact, I heard, and it could be just rumors, but I heard that they may make subtle changes in the future coming up. And I don't want to wait until those subtle changes reflect maybe a harder test. So I need you to get your shit together and do this now. Now, whether or not you come to my class directly or you use my free resources, call me, boo. I can help you. This is the time for the nurse who said they couldn't do it, would never try it again, failed too many times, graduated too long ago, 20 years, 30 years, 10 years, whatever. If you've been following me on HETV, you know that under inspiring testimonies are nurses from Australia, nurses from England, nurses right here in Ohio, nurses that graduated 20 years ago, nurses from the Philippines. I mean, come on now, just do it. Here we go. Number 2. We now know, and kind of did know before the test came out, that you've got to know your content. Like, you freaking got to know your content. Well, that sounds cute, Shelly. What the fuck are you trying to say? I'm trying to say that it's not enough to do questions. And you know, I have my software that I love, and everybody knows that we do software in my class every freaking day. But that is not enough. You must get content from somewhere and learn it. And to do it right, you're gonna have to kind of sit down, learn some shit, take notes on some shit, reread that shit, and practice that shit. Because if you just do test questions and think, oh, I'll just take notes on the rationales, no, that's a spot check on that disease. You really need to understand the pathophys. If this test has taught us nothing, it's taught us know the content. Now, of course, you know your girl. Again, shit is for free. All you have to do is go to the playlist of HETV and you will get all of my content for every disease, every single system, body system. There it all is for free, and it's organized so that you go to the psych playlist, there's nothing but psych videos. You go to cardiac playlist, there's nothing but cardiac videos. You go to neuro, GI, pediatrics, maternity, boom, you got this. It's all content and it's free. Who does that? I know. Number 3, of the 7 new revised tips of how to pass the new next generation NCLEX exam is know your meds. Oh my God. So listen, again, I might be persuaded to give out some free shit. I have for you, and you're just gonna have to stay right there because I'll be right back. I gotta run and go get it. Woo! Hang in there, I'm coming. Oh my God, I forgot. I should have showed you this shit earlier. Here I come, y'all been waiting. Are you hanging in there? Whoa, 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 whoa. I'm back. Okay. Pharmacology, medication categories. Both. I might be persuaded to help a sister and a brother out. Here's the deal. Unlike you ever saw before, it becomes super duper critical to know your meds on this next generation NCLEX exam. Well, but why, Shelly? Didn't I have to know my meds before? Sort of, but it's different. You could get a case study with 10 meds in it, and I'm so serious. And so I need you to know that even though this video might seem kind of long, you're sticking in there with me and you're going one by one and you're focusing on this, and watch me do this. Know your meds. Not guess, not think, not maybe it could be possibly. No, freaking know these meds. How do you know meds? I know it sounds bad, but there are 3 things that you can actually memorize on this test and any other test. One of the things you're allowed to memorize is meds. How does that play out? You make flashcards. How do you make the flashcards? Well, my daughter worked at Walgreens and they made, like they gave her professional flashcards, right? And so on the front of the card was the generic name of the drug, because you know, if you work at Walgreens, you gotta know your meds. She's pharmacy tech, right? So on the front of the flashcard was the med. On the back of the flashcard was what it was used for, any other name for it, what category it belonged in, and you know, basically that kind of stuff, not much. One name on the front, 2 or 3, 4 things max on the back. Maybe some contraindication or some god-awful side effect. So let me give you an example. If I put lisinopril on the front, on the back, I'm gonna say ACE inhibitor. I'm gonna say number 1 side effect is a cough. I'm gonna say treats CHF and hypertension, you know, that kind of thing. That's what I want you to know. Okay, so you gotta know your meds. The 5th new revised tip for how to pass the NGN NCLEX exam is study your infectious diseases. Oh, I know you're sick of me and these infectious diseases, but reality is there's more infectious diseases, and I don't have to run as far. I got it right over here for you. And once again, if you need my help, I got you. Because these infectious diseases, you can make flashcards out of, and I'm gonna show you, hold on, hold your ponytail, boo. I'm gonna show you how I've already made them a list for you. So these are what you would be making flashcards out of. You see where I'm going with this, you guys? Again, I could be persuaded to help a brother and a sister out, okay? Now, it's not enough to know the infectious diseases. So I realize I need to teach you how to make that flashcard. The infectious disease goes on the front of the flashcard. So let's give you an example. Impetigo. On the back of the flashcard goes a brief description. Honey-colored crusted pustules, number 1. Number 2, itchy infection caused by strep A. Number 3, preschoolers. You could put a number 4 and put no vaccine or something weird, but again, on the front, impetigo. On the back, oh, most importantly, precautions. So front goes impetigo, back goes contact precautions, after that goes preschoolers, after that goes honey-colored crusted pustules, or whatever order you want to put that in, and then you could put caused by strep A. Y'all feeling me yet? because I got everything you need. I got the little precautions, I got all this crap. And then if you take your butt with that little list of infectious diseases and you go to my playlist on HETV under infectious diseases, you got this. I'm telling you, you got this. All right, I'm too old for this, but I'll continue, okay? Number 5 of my 7 new revised tips for passing the new NGN NCLEX is to know your EKGs. Here again, you can make your flashcards. Here's reality, and I think the new test figured it out. Based on what I'm figuring out with this new test, based on all of my research about this new test, it's based on what our nurses expected to do the minute they hit the ground running. And all over this country, we know that nursing floors, like regular med-surg floors, have turned into telemetry units. Telemetry means continuous cardiac monitoring. Because of that, the nurse is responsible for recognizing an abnormal strip and letting somebody know about that shit, right? So you gotta do this again with your flashcards. And again, your girl has got you, because you know we have an EKG handout. You know that, right? You know that that EKG packet has all your EKGs in it. You know that, right? Okay. So what you're going to do is you're going to make your flashcards, and I'll give you another example because I'm your girl. If you put SVTs on the front of the flashcard, on the back of the flashcard, you better say heart rate over 150, adenosine slam, push very fast, short half-life. You know, you're trying to think of this stuff. Sometimes asymptomatic. Just saying. If you put, let's do another one, okay? Let's just have fun and do another one. If we put VTAC on the front of the flashcard, then you better say check the pulse first. If positive pulse, cardiovert. If no pulse, defibrillate after CPR. You feeling me? I hope so, because I'm working hard for player. Okay, so look at here. We're doing this. We got, it's okay to make flashcards with your meds. It's okay to make flashcards for your infectious diseases. And it's absolutely okay to make flashcard for your EKGs. Now, I do want to say something to you, because some people be like confused and shit, thinking all they got to do is recognize the EKG. No, boo, no. You got to know what caused it, and you got to know how to treat it. And that's why I already have that information for you under the playlist. So you ready? Because we're moving here. Okay. The next is take your time. Now that we have case studies on this new test, don't get it twisted. There are 2 different types of case studies. There's the unfolding case study, and those have 6 questions each, and it requires you to click on every single tab, read and reread and reread again a lot of information in order to be able to answer these questions. It requires in that unfolding case study that you know your clinical judgment, like you know your name, so that when you answer it, the answers are all going to apply to these 6 clinical judgment steps. And don't forget what I said. For every case study that's unfolding, not the single case studies, no, for every unfolding case study, question number 1 is going to require you to recognize cues, which is looking at the patient's signs and symptoms, some of their risk factors. Y'all feeling me? The second question in every single unfolding case study, and there's at least 3 that you got to know, unfolding, I'm saying. You got to know how to analyze the cues. It's not enough to know, oh, look at there, the patient's 15. No, boo. If you recognize the age as a cue, then you better be prepared to analyze what that means to the nurse. So The recognize the cue is that she's 15. The analyze the cue is that because she's 15, I might need to make sure there's an informed consent from her parents. I might need to make sure if it's a female, she's not pregnant because she's damn sure childbearing age. I absolutely would have to remember at 15 that growth and development will play a role in my answer on the test. Y'all feeling me on that? Oh, okay. Then you had to know that the third step in clinical judgment is to prioritize the hypothesis. Here you're looking at what kind of diagnosis are we really working with. And I got to remind you, it does say prioritize. So I'm not going to prioritize GERD over pneumonia or pneumonia over a PE. So that's how you're prioritizing your hypothesis. When you look at generate solutions, okay, nurse, now that you know what's up and what is going on and what type of diagnosis there may exist, what you gonna do about it? Generate a plan. In other words, when they say generate solutions, you developing in your mind a plan of care. Oh my God, I think that this is meningitis. I'm going to prepare my patient for a lumbar puncture. I'm going to make sure in my plan of care is seizure precautions. I'm going to make sure Sister Girl is in a private room. This is not a doctor's order. These are things you are doing to generate a plan of care. You know when you should notify the doctor. You know that your S bar is part of that generate the solutions. You feeling me on this? So you got the recognize cues, analyze cues, prioritize hypothesis. So what did you do in the first three? Recognize, analyze, prioritize. Boom. Think. That's what you did in the first three. You started thinking critically what to do in this clinical situation. What did you do in the last three? Act on it. You put your precautions in place. Seizure, for meningitis, like seizure, private room, whatever. Take action. Oh, boo, it's time to work. You know how to work. You got to work on this one. You got to start the IV, hang the IV, get the mannitol going. Make sure you send them fluids off for studies in the lumbar puncture. You got to make sure you take them vital signs. Very often, this is a deadly situation. You got me on this. I mean, I ain't got to go through the whole meningitis. You already know what it is. Okay. What about evaluate outcomes? If Sister Girl's LOC is dropping, I bet you better think that ICP is rising. Okay. So you're looking at what's making her worse or what's getting her better. And to do any of this requires that you take your time. I always tell my babies, by the second hour of this test, this new next generation NCLEX exam, by the second hour, hour 2, you get prompted a break. At that point, get your butt up and take a break. But before you take that break, look at your counter. See what question you're on. If you pass number 60, you're going too fast. I know that sounds crazy as hell. Because remember in school how you had a minute or so for each question and they damn near rushed you through the shit? No, this is different. It becomes even more imperative on this new next generation NCLEX exam that you take your time and read this shit. So if you're past 60 questions, you got to go to the bathroom, redirect, ask God, slow my road and slow down. Okay? Now, I know this is redundant, but I'm going to say it. Practice makes perfect. Practice, 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 practice your case studies, fool. You gotta practice. What the hell did you think this was about? You can't just jump in this new test and think you got it like that. So when my students go and they tell me, because I ask them, they stand right up here, because you got my inspiring testimonies on HETV. You can look it up at yourself. You will know I'm not lying. When I ask the students, tell the class what you could do to prepare yourself for this new test, they say, oh, your case study is going to prepare them. Because the case studies that I give my students are right on point. And don't let it bother your Jerry curl, because we're about to do it with you too, boo. I got case studies in there now. Come on now. I mean, I'm begging you to understand You can pass this test. I really feel in my spirit, God sent us this test, y'all, to get everybody to pass. If you want a license, this is your time. Get off your couch. Get selfish. Make it about you. Tell them kids they're going to be eating peanut butter and jelly for the next few weeks. Make sure you don't apply for your ATT until you're good and ready to test, because some of y'all applying in these different states and they got a 3-month deadline. I'm in Ohio. We spoiled. We get a whole year. You don't need a year, but still, you know what I'm saying? So get up, tell your man, we ain't finna do nothing till I become a nurse. Let mama and them know they on front base, they on third base, because you can't do nothing with them right now. Tell the church, amen, but you can't come every day on Wednesday and Sunday. Y'all feeling me yet? You got to do this. This right here requires focus. Stay focused. Bye, y'all. That's all I got. Oh, nope. I promised. I promised you. I know I promised you. Here you go, boo. This for you. You see what I'm doing up here? I am writing my email because I do have free shit for you. That's number one. If you just challenge all the way live and you want to talk to me or text me or 0936, give your girl a call. We got self-study packages with all these handouts, including all the pink ones I showed you, for like $300 some. So give yourself a